The recent pandemic we had in 2021, you might not forget, because the whole world was under a lockdown because of the pandemic. There is one more pandemic that is coming. In the pandemic that went by, I single-handedly saved around 15,000 patients. We did not use any drug, we did not charge them anything. It was free of cost, because that time it was more of, it's called a seva. It was a charity because people were sick, they were not getting seats in hospital. So we did it. I'll tell you how. In future also, if there are diseases like that come, there are only 3 ways how any pathogen can enter your body. It is either by ingestion, inhalation, or injection. These are the only 3 ways by which a pathogen coming from outside can enter your body. It's called a communicable disease. So the difference between communicable and non-communicable is, communicable diseases, the pathogen comes from outside. In non-communicable diseases, inside cell becomes pathogenic. So these are the only 2 ways how one gets diseased. So pathogen coming from outside, this body is going to react. This is the most intelligent piece of thing on planet Earth, the most intelligent. So this is going to react. The reaction will be fever. So why did the fever come? To kill the pathogen. And what did the world do? It lowered the fever. Yes, you will not feel very good when you have fever, but one thing is sure, you're not going to die with fever. You are going to get dehydrated. So for 7 to 8 hours, hydrate the patient with water. On an average, on a 60 kg weight gentleman, adult, 5 liters of water should be given orally. And water can be of many varieties. So we did exactly that. 95% patients in 6 to 7 hours to 8 hours time, the fever went back to normal. The people with comorbidities, they took around 15 to 20 hours, at times 24 hours. But in 24 hours time, everybody's fever went off. After 24 hours, what will the body do? The second thing that the body has to do is, the pathogen is killed now, so the fever went down. The cells that are affected because of the pathogen, the body has to kill that also. So what tool does the body have? The body will decrease oxygen concentration. A normal cell can tide over this situation. A diseased cell will die. So the decreased oxygen concentration, what did people do? They gave oxygen. One thing that we have to unlearn is, we don't take in oxygen and release carbon dioxide. We take in air. Air has got 20% oxygen. So this 20% oxygen that is going inside, this device called the body exactly knows how much oxygen to be extracted from the air. If you're giving more oxygen, oxygen favors combustion. So if you're getting pneumonitis, if you're getting pneumonia, beware. It could be because of the oxygen, plain oxygen that is being given. Air should be given. So what can happen is, there are ways and means of getting more air. First is, you look at the nostrils. If one of the nostrils is blocked, try to open that nostril so that both the nostrils are open and you can take in air. That is first. Second is, you lie down on your stomach and start breathing very heavily. You will see that both the nostrils open and you can take in air, and in no time you will see the oxygen concentration coming back to normal. So there are other ways and means of giving air, not oxygen. That is number 2. And on the second day, you have to give a lot of fruits and you have to stay in the sun. for at least 2 hours on day 1, day 2 and day 3. So day 2, fruits only, no juices. Yes, you can take juices if you cannot eat fruits or you don't have teeth, then you can take juices. Till the time you've got teeth, try to eat the fruit. So lot of fruit and 5 liters of water is there. You can have nariyal pani also, you can have nimbu pani also. Nariyal pani is coconut water and nimbu pani is lemon water. You can have all these, but lemon water means lemon and water, no salt or sugar. Third day, patient will crave for salt. So you can have, we call it khichdi in India. It is a mixture of rice, lentils and a few vegetables that are put, and it is boiled, and a little bit salt is added and you can have it. That is khichdi. 5 liters of water is still there. You have to have fruits, and on 4th day you are disease free. So mostly patients with any kind of pathogen coming from outside causing pneumonia or pneumonitis like symptoms, if it is getting through the lungs, this is a 3-day protocol that needs to be done. Did I mention any drug? Did I mention any drug of anything, whether it is allopathic, Ayurvedic, Unani, homeopathic? No, we did not mention. This is the bright example of let food be thy medicine. Thank you.